Piedmont. After residency, it'd be like, okay, this is the good years.
What's your commitment here? How long will you be here?
3 years.
You'll be here for 3 years?
Yes.
At this clinic?
Yes, residency is 3 years, and being a part of the rural track, we stay here for 3 years during residency.
All right. So, we're here to hear about that track. So, how did you end up here?
Well, it's a long story, but I'll make it quick. Originally from Brooklyn, New York. Went to undergrad in Massachusetts at Brandeis University, and then navigated my way here because my family is actually from Charlotte, North Carolina. So I knew I wanted to spend more time with my family. So I knew I wanted to take a gap year before medical school. And so during that gap year, I worked as a medical scribe at another federally qualified health center in Durham, North Carolina, which was a great experience and led my journey into wanting to work at a FQHC.
What does it mean when it's federally qualified?
Federally qualified means that the government helped with assistance in providing health equity within that community. So usually it's in underserved communities, low socioeconomic communities, and the government provides funding to help support the needs of that community.
So with that in mind, what type of patients, can you just paint the picture for us? What type of patients do you see here?
So patients here are like from marginalized communities. We have migrant farm workers. We have African American members within the community. We have a broad spectrum. It's just anyone who needs assistance. Even if they don't need assistance, it's just a great place to get adequate care. And by that, it means like full team-based care. So we have behavioral health here, we have dental, we have pharmacy here, and they can get all of their care within this place.
Why is this a place where you wanted to be beside the geographic element because your family lives in North Carolina?
Yeah, so I wanted to be here specifically because I wanted training at a federally qualified health center. I know ultimately my long-term goal after residency is to be a part of a federally qualified health center and specifically have a leadership role. I want to give back to the communities that I grew up in, coming from a low-income community, not really having access to health care. My mom was a single parent, worked long hours. It was always hard to get the adequate health care, whether that's transportation, finding time to actually go see a doctor. I knew I wanted to give back, and I knew I wanted to be a part of a community that had similar issues.
Yeah, and why is it? Yeah, sorry. Okay.
Oh.
I'll do it.
Oh.
Okay, thanks. Good morning. We're still wrong.
So that's really, so wonderful that you want to give back. And how did your experience influence you in that way?
Yeah, so most of my family lived in low socioeconomic communities, and so for me, seeing and witnessing the challenges and barriers they had to healthcare, like I said, whether it's transportation, financial reasons why they couldn't afford their insulin, or make it to their appointment because they had to go to work and had to work long hours to support the family. I knew I wanted to give back in that way by being a member of the healthcare community where I can be there to support members who are having similar issues.
Wow, they're really lucky to have you.
Yes.
It's so wonderful. So what has it been like?
Oh, it's been amazing. It really has. Being able to give holistic care from a team-based approach has been incredible. So knowing that when I see a patient, I can work on their medical issues, but also their socioeconomic issues, whether they need help with transportation, whether they need financial resources for their medication. It can all be done here, and that's what I love about working here.
What are some of the challenges that you've seen working here?
Oh, there's always challenges no matter where you work. I think the biggest challenge so far has just trying to find access for some of my patients or getting my patients back in. We work with the migrant farm workers, and sometimes it's hard for them to come back in. Normally when they come, you want to try to get as many things as possible done. So I found like that may be one of the challenges, and just being a new intern, a new doctor, just navigating through the system of just being at Piedmont has been a little bit of a challenge, but challenge I'm willing to take for this patient population.
Why is this important work for those sitting at home watching, maybe someone like myself who doesn't live in a rural area? Why should we care?
Well, it's just a righteous pathway to be on. Like, we want to be able to provide health equity for marginalized communities. And it's important that we all be able to receive the health care that we deserve. It's a human right. So I think it should be important that we serve these communities, whether it's within a rural setting, urban setting, it's important.
All right, perfect. All right, let me see what I have here in my notebook. You told me why you decided to enter. How is this experience different than other tracks that people go on?
Oh, well, I'm not sure what everyone else on the family medicine track or the university track would, what it's called now, experience. But I feel like here, our patients really appreciate the work we do. Not saying that they don't at the other tracks, but I think here we get to see a full scope of what it means to take care of population, and not just the medicine piece, but also their social determinants of health and being able to find ways to address those with limited resources.
Perfect. Okay. You talked about why you think it's important to focus on those underserved and underinsured. How has the training been different from what you expected?
Well, I'm still in training, so far I love the fact that we spent the month working with the community. So we spent the day going out into the community and learning about just Yanceyville, Roxborough, seeing where the patients live and understanding some of the barriers that they may have. So I love that day where we just went out into the community and see what resources are available. And then we're working with community leaders to understand some of the barriers to care within the community. So I think that's a unique experience that not a lot of other places have.
In addition to caring for these folks, I thought when we were talking earlier that it was really interesting, the impact that you're hoping to have beyond caring for them in a medical sense. You're hoping that maybe some of the folks that you serve can see themselves in you.
Yes, especially working with my adolescents, just giving them an option and letting them know that there's, things outside of the community, outside of those barriers you can, grow from. And, whether that's being a doctor, being a lawyer, whatever you want to pursue in life, that there's hope and there's opportunities.
Yeah, that's really wonderful. I really appreciate you talking to us. Anything else that you'd like to add?
I don't know. Like, I love it here. It's been a great experience so far. I'm 5 months in, and I already feel like this is the community that I want to serve and want to be a part of.
That's what they're hoping. They hope that by giving folks a taste of working in a setting like that, you'll be hooked.
Exactly.
Can you understand that?
Exactly, and I'm already hooked.
Because what is the reward that you are experiencing already?
Alrighty, just the gratitude, just knowing that I'm making a difference in someone's life. I'm making sure that I'm doing everything I need to serve the community. So that's been the best reward so far.
I will say that when I pulled up here, I thought to myself, well, if I were a doctor, I'm not sure that this is where I would envision myself. You get into it, I think, sometimes thinking big hospital system, bankroll, the whole thing, right?
Yeah, but it's not always about the money. It's not about the money. It's about, bringing happiness and bringing health equity to, marginalized communities. And that was always my goal. I wanted to be a doctor since I was 8, from seeing and experiencing what my family went through. So it was a no-brainer for me. I always wanted to be a doctor for that purpose.
Well, I feel you. We got into journalism, so
No,
we know money isn't isn't it?
PBS,
We don't know much about money.
I mean, yeah, busier than I'd like it to be sometimes.
Okay. All right. I'm going to start off, and your conversation, you and I,
Yeah.
forget the cameras, and I'm sure you know the drill. You know the drill. It's a
We'll see.
conversation. Yeah.
Yeah.
And so tell us, where are we, generally speaking, where are we, and what do you do here?
Yeah, so we're in Prospect Hill Community Health Center through the Piedmont Health Services. It's a federally qualified health center that's in Caswell County, North Carolina. So we're about 20 minutes from the Virginia border and about 20 minutes north from Hillsborough.
So you care for, is it safe to say, how would you describe the patients that you care for?
Yeah, so our biggest goal is to take care of an under-resourced, underserved population of North Carolina, people that have a hard time accessing healthcare in other fields. A lot of our patients are uninsured. A good majority of our patients are undocumented. We don't ask that question in terms of our demographics, so we don't have an exact number. But a lot of our patients are migrant farm workers through the Migrant Farm Worker Program. We take care of patients in all stages of their lives. So from birth to, we have some 100-year-old plus patients out here. So it's lovely.
Why is this care so important, particularly for this demographic?
Yeah. So to me, the care is really important for this demographic because it's really hard for these people to access healthcare in kind of the traditional senses. It's hard for them to travel to bigger cities, bigger academic centers for tons of different reasons, for reasons of trust for bigger healthcare systems, for reasons of trust of people outside of their kind of community, cost issues. Gas is expensive, care is expensive. So it's really important to me that we access our patients exactly where they are, give them as much care as we can under the roof of this building so they don't have to go outside of the confines of our walls to get health care.
Tell us about this residency program that you have.
So it's a really important thing to me, a big reason that I came to UNC for residency. And it trains residents in the setting of underserved medicine. So it kind of teaches them how to practice medicine along with teaching them how to practice medicine to an underserved and under-resourced population at the same time. The goal when our residency program was founded about 12 years ago, the goal was to be able to populate the physicians in rural and underserved areas to be able to practice in these areas. And so far, we've been really successful in that goal. So
I'm gonna have you fix your hair on,
Oh,
on
thank
that
you.
side. Yeah,
Sorry.
there, perfect.
Thank you. So tell me where I need to start back from.
I'm right here. As far as your hair is
Thank you.
concerned.
This is important
The,
to me.
the interview part is great. I'm just watching out for your hair.
No, thank
Because
you.
you're
It's
doing wonderful
important.
with the interview
Important.
part. Necessity was the reason behind this, right? You
Yes.
wanted to find doctors who would
Yes.
actually come out this way.
Exactly.
Yeah.
Not only did we want to find doctors that would come out this way and practice in rural areas of North Carolina, we wanted to find doctors that would stay and continue to practice. I think we see this whole kind of brain drain float away from, you come and you practice for 2 to 3 years, you get your loans paid off, and then you go and practice somewhere else that might be higher paying or maybe less stressful or closer to home. But we wanted to really kind of take that passion of future doctors and train them early on so they really recognize how to practice medicine and how to take care of an under-resourced population simultaneously.
How is it different caring for the type of patients that you're caring for versus if they were doing their residency someplace else?
So you really have to consider, to me, the difference is that you really have to consider the patient's resources, the patient's abilities, the patient's kind of health literacy at the same time that you consider how you practice medicine. So I always tell my residents that I think that we need to be very creative in the way that we practice medicine. Somebody might come in, they might have concern for a pneumonia, for example. And, typically we would order a chest x-ray, we would use kind of the various tools that we have in our toolkit, but we really have to be comfortable as physicians practicing to kind of the utmost of our license without these extra tools, because our patients might not be able to travel 45 minutes to get an x-ray. So we have to kind of sit within our own comfort level, our own medical knowledge to decide what we can do to treat that patient without having them travel elsewhere.
The approach that you're taking, trying to not only attract residents here, but get them to stay, has it worked? Is there a sticky factor here that people get hooked?
There is. We've been really successful. So out of our residents that have graduated from the program, we're close to about 30 now that have graduated just from the Prospect Hill site. We've had over 75% go out and practice in medically underserved communities. And we've had now 10, 11 years into the program, about 70% of them are still practicing. So that's a really high retention rate.
what do you attribute it to? Why are they staying? Why are they continuing to serve this underserved population?
I think there's a lot of different factors. I mean, I think that we show them as they're practicing medicine that this is something that's fulfilling, this is something that's doable. I think we attract the right residents as well. We attract residents from all over the United States of America, including people from rural spaces in North Carolina. And we gather residents with that passion and that desire to learn. And then it's just a really fulfilling place to practice. I feel like all of our residents feel like they can go home at the end of the day and feel like they've done their job. And that's a really important thing to feel in healthcare.
Very, very good, very good. Okay, let me look at these. I always have these questions written down, and then I go off on tangents.
No, your questions are great. I prepared last night when I was too sleepy.
You talked about the challenges, what makes the rotations different. What is your hope for the future?
So my hope for the future might be a little too like pipe dreams in the sky. I hope that we're continue to be supported. We've gotten some really great grants, and now we have this like sustainable support from UNC School of Medicine and the UNC healthcare system that allows our our residents to continue to come and practice in this program. I hope to expand. I think this model is working really, really well. I think this model of training residents in a federally qualified health center rural environment is successful. And I hope to have more spots for residents in North Carolina programs in the future, and to be able to plug residents throughout all of North Carolina, not just Central North Carolina.
And finally, what would happen to a place like this without this residency program?
We've seen it happen, and it happened before we came here. There's a giant turnover of physicians. So people feel like they don't have a primary care doctor. People feel like they don't have a primary care physician that knows them or understands them. So we'd see this constant turnover, this constant lack of ability to access a provider, and this feeling like they need to travel outside of their community that they feel comfortable in to get the health care that they need.
All right, perfect. Anything else? Anything else that you'd like to add that you thought about late at night?
No, I wanted to talk about the retention, so I'm glad I got that in.
Yep.
I'm trying to think of how I answered the question about why it's different. I hope I answered that well enough.
Okay.
Why it's
Do you
different
want
than
to
other
take
training.
another crack at it about what makes this rotation different?
Yeah, I think I was a little run on. And I just want to clarify too. So it's not, for the purposes of whatever, it's not necessarily a rotation.
Okay. Scratch that.
It's so. Oh, sorry, David. It's the word that we use is track, which again is a little nuanced that I think is confusing to people. So rotation implies that like you're doing like 4 weeks here. This is what they do throughout their entire 3 years of residency. So it's their training site, which makes this, I would say, maybe training site different.
Okay.
Than rotation.
All right. What makes this track/training?
Thank you.
You said training.
Training site.
Site different. Yeah. What makes it different?
So I would say that what makes the track and the training site different than the typical residency training experience is really that you have to learn kind of the social determinants of health, what the factors that really influence our patients' ability to access health care at the same time that you learn to practice medicine. I think it's really important to learn the factors that cause a patient to be able to get their medicines, to take their medicines, to understand their medical diagnosis at the same point that you learn how to treat common conditions like pneumonia and diabetes. I always tell our residents that it's really important to kind of use all the tools in your toolkit and feel really comfortable with the situation that you have in front of you before you start referring out and getting extra lab tests and diagnostic tests. And I think our residents do a really good job with that. To me, that's what makes this individual.
Do you think that this program helps make these young doctors better doctors, and why?
I don't think that it makes them better doctors overall. I think that the training that they get in any residency program is great, but I do think it makes them better doctors for rural and underserved communities.
All right, perfect. Wonderful. Thank you. Makes you think different.
Not be in this picture. Like you won't be in this picture. Sorry.
You're not feeling like being
No, not really.
however many 30 weeks pregnant?
computer.
Oh, that looks like fun.
Okay. And
I'm just acting like I'm doing work. Tell me if you want me to be
then, I
doing
know I'm like technically trying to do work, but at the same time I'm like, oh, should I actually be doing stuff? I don't know. I'm just glad all my people are follow-ups, which is exciting.
No, I've got some people that I don't know who they are.
I'll take any of your adolescents.
Do you want babies? Do you have any adolescents? My people. My people. Don't you worry.
I'm gonna go see these first. Too,
Okay,
but
good.
then I should be ready whenever you're.
No problem. I should be here at 2.
Who do you have?
So I'm doing a cryo.
Ooh.
Keratosis. I've never done one, but I've seen it and it looks very easy, just for the space. But I'm sure there's a method to the madness.
Ooh, and actually, yes, we were running out of liquid
I
nitrogen.
heard. So can I
I
still
was
do
able to do
it?
some this morning.
It's only on his forehead.
I think I saved a lot of mine in the thing beforehand. Let me go look and see.
Did
Sorry.
you do some this morning too, Kelly?
I did.
I
I
was
like
gonna,
had to dump it out.
Oh.
What time did you do yours?
Okay. Should I reschedule or?
Let me go.
Sorry.
There's a machine number.
So they said they prefer not to. I'm sorry.
No, no worries. Is that it?
For the world to know that I'm the boss, right? So if you want, we can hang out here. Show me how to write.
Like, if that makes sense.
That's the nice thing. You okay?
I'm fine.
How was the removal of the cyst on your back?
It's good. It's I can still feel it,
Yeah.
but I mean it's no pain there at all.
They sent me a letter and they're like, that had been there a long time. I was like, she warned
Yeah.
me that it had.
But
But
it
they
was-
said they got all the parts out that they needed to get out. Which is
Yeah,
good.
it doesn't. It cleared right up. I kept it. I changed it every day, and then
Good.
it was nothing, so I just quit changing.
And they didn't put any stitches or anything in it?
Uh-uh.
Take it. I'll take it. So one thing that can I talk about whatever? Sorry, I just looked at the camera.
Yeah.
Okay. One thing I'll have to have you do, so don't let me let you leave here, is we have to have you sign like a patient release form. It just says I agree to be
Okay.
on camera. And it gets scanned into your chart.
Okay.
So everything is official. And I'll have Fabi, who's the nurse that I'm with today, come in and take your blood pressure. Turn left. Did you hear your phone
Yeah.
giving you directions?
In this arm. Not this one.
That one?
No.
Yeah. So what's going on with your arm?
I think it's the arthritis. I really do.
Is it?
This is the elbow, and from the shoulder to here. Now when I do this, that hurts.
Okay.
I can't pick up anything.
Did you
I know it's arthritis. You know, Uncle Arthur loves me.
Uncle Arthur led
He thinks I'm his damn home house.
Did you have any falls or
No.
nothing recently?
No.
Dr. Roberts, can I interrupt
Yeah,
for a second? Can
absolutely.
we get you doing any type of, because we don't need to get too much in the whole
Yeah.
visit, maybe
I
examining
was
or
gonna
checking
say,
vitals or something
yeah.
like that?
Just checking.
I was gonna do.
Oh, you want to do it? You want her? You want to watch her?
You wanna
Well-
you wanna see the pain. So I was gonna do like a physical exam. Is that okay?
Perfect.
So I'm just gonna check out your arm, and I'll do this again later too. So when I examine you, I'm gonna start in your shoulder first, okay? Any pain here when I press in?
Right there.
Right in here. So right in here. What about back?
No,
Nothing back here.
no. That's where that place is.
Oh, sorry.
You just touched
I'm
it.
sorry. I remember
That's
it
the
was
first
around
time it's
there.
hurt.
Well, I'm glad I pressed hard enough, huh? And then nothing down here on your arm when I press in.
Not now. Now
Okay.
last week it was.
Last week it started. All right. So when I go like,
Oh, that didn't hurt. Go ahead and do it again. That's not it. That when you do this way,
when I turn it this way,
it
it hurts.
hurts.
Okay. So when I turn it over this way, it hurts. Put your arm out like this and put your wrist down. And I'm gonna try to have you press up. Can you like press up towards the sky? Does that hurt?
Yeah, I can
Okay.
feel that right in here.
Right in
Right
there.
here.
Does that cause any pain in your shoulder at all?
No.
Okay, now I'm gonna do this. So I'm gonna have you go. Pain it there at all? No? Okay, I'm gonna bend your arm like an H. I'm gonna go like this.
That hurts.
In your shoulder or in your arm?
Right in my elbow.
More in your elbow. Okay. And then, now, grab my hand. Try to turn me over like you're turning over like a cup of soup.
Hurts right in here.
Right in there. Okay. Yeah, so I actually, without even checking stuff, have a sense of what I think that this is. And we would, do you mind if I roll your sleeve up a little bit? A lot of times we can treat it conservatively. And I'll ask you a little bit more about like what you've done to treat it conservatively at home. So that just means that we can do some stuff here with medicines before we would think about doing an injection. But we might need to do an injection, but we would start off with like some conservative stuff. Put your arms out. I'm going to test for weakness. Don't let me push you in. Does that hurt at all? No? Make a fist. Try to open it against my hand. No? No pain? Okay. Can you feel me touch you here?
Mm-mm.
You can't feel me touch you? You
Yeah,
cannot.
can I feel
Okay.
it?
I
Oh,
was gonna say, I
yeah,
was like,
yeah.
uh-oh, we got a stroke.
I thought you
Um,
meant did I feel this pain?
I knew you were. You can feel me touch you there. There. Good. There. There. Go like this. Try to. That hurts. Okay. Try to push me away.
That hurts.
Back. Try to pull me back.
We're good.
Good.
Thank you very
All right.
much.
Stop torturing.
And anytime.
Take one. Hello, I'm Dr. Pugh. How are you?
Margaret, nice to meet you.
Nice to meet you, Margot. Is it okay if I do an exam today?
Yeah, for
Of
sure.
course. Okay, I'm just going to take a look at your ears and your eyes.
Okay, sounds good.
All right.
Stop a second. Sorry, I got to stage this. I
No,
apologize.
no, you're fine.
And anytime.
All right, just going to take a look. Oh, your ears look beautiful.
Oh, good.
Tilt your head to the left. To your left. There you go.
Okay. Any more than that?
Yep.
All right.
You can do blood pressure or whatever you want to do.
Oh.
Or eyes or whatever.
I'll check the blood pressure. Somebody
A
does
large
it.
cup, so that'll be great.
Just
There's also, I think,
there you go. Yeah, pretty big cup, but that's okay.
it's actually not the right way to do it, just because you have your clothes on, but it's okay.
Do me
It's definitely above 80.
Great.
Can you hold the bulb up higher so I can actually see the bulb?
Oh,
Yeah,
okay.
there you go. Perfect. A little bit higher,
Okay.
if you can. A little bit higher, because I'm
Oh,
behind her
higher,
arm. There you go, if you can.
Ready?
Yep.
Okay.
Really good.
Cheers. want to wait.
Oh, perfect. Great.
All right. Blood pressure looks great.
Glad to hear that. You're actually listening to my heart.
Yeah, of
Okay.
course.
Great, thanks.
Good to see you. Take care.
You too.
Thank you.
Can you take some deep breaths for me? Deep breath. Deep breath. Deep breath. Your lungs sound clear and your heart sounds great.
Glad to
Good,
hear it.
perfect, thank you guys.
Everyone's experience is different. I think just for us at least, we just get broad practice. So
There have been laws passed since probably your mom was in that it was doing trainings.
Your
There are
second
some
one
more limited
literally
trainings
just
on
turned
resident
blue.
work hours.
Intense. Yeah, so it's still intense. Yeah. Appreciate it. I'm in my third year now. You're in your third year. Thank you, ladies. Appreciate it. Yes, absolutely. Thank you. Good luck. I don't know. You think we're gonna knock
Well, did you want another? Okay, go around the corner. Action. Perfect, thank you.
all that stuff. So,
Very cool. Small world.
yeah.
Well, we don't want to keep you too long. We wanted to talk to you about this residency program
Right.
that you have, and just the benefits of it, just in a general sense. So we kind of got the ins and outs of how it works, but I'm just wondering, from your perspective, what do you see as the greatest benefit of this program?
It gives people a chance to learn how to do medicine in a community health setting, I should say. And because of that, what it does is it allows us to then have people learn what it's like to take care of poor people. And really, anybody who goes through it understands it's more than just the medicine that you're giving somebody out. It's really about their life and how to take care of a person in community. And that's been the biggest piece. And then for our staff, it's great, because our staff then feel like they're teaching everybody. Everybody from our MAs feel like they're teaching residents and all the above. So it really ups everybody's game. So it makes it a better place to work clinically, and it's just a more exciting place to be.
What are some of the challenges that you face when it comes to finding providers for these settings?
So for us, for just the residents themselves, we don't have that problem. We have more residents who want to come to that residence site than we have spots. So that's why we opened up a second spot, or we'd love to open up a third spot, because it's an exciting place to learn medicine in a community-based setting.
I guess I mean from a general sense, when it comes to our underserved population,
Yeah.
how big of a challenge is it, generally speaking, without this program, to get physicians to work in these settings and serve the underserved?
Yeah, so there's enough people who do primary care that this is what they set out to do in life, so we can get them interested to come. What really makes a difference in helping them financially do this is there's a National Health Service Corps program, and there's a state loan program. So if you come to work in a health center as a physician, advanced practitioner, or dentist, you're able to get a loan repayment of anywhere between $25,000 to $40,000 a year over multiple years. So that does a great deal to reduce their debt, and it gets them a chance to see what this life is like. And once the debt is finished, then people decide whether they want to stay with us or go on to something else. But that's one of the ways that we can work with federal dollars to help people in community stay in community.
Yes. And then when we look at a place like Prospect Hill, I mean, I can't imagine there's a lot of, I know this program is very unique and people are lining up, but not a lot of physicians, generally speaking, lining
No.
up to work at the clinic at Prospect Hill, right?
That's correct.
Yeah.
Yeah, so for us to do that, we believe it, to work in a community health center, it's just like putting your hand in a glove that's a perfect fit. Sometimes you see gloves on a counter, you say, I want that pair of gloves, and you put your hand in it, it just doesn't quite work right. It's just getting the perfect fit. So it doesn't work for everybody, but it's always a challenge. But what I remind everybody now is that there's a shortage of doctors every place. We don't have any less of a shortage than anybody else, but it's always a challenge. So that's why having a residency actually just creates more doctors to come practice. So the more residency sites that everybody can create, the more opportunity we will all have to see a doctor in the future.
Yeah, that's great. And then talk to me a little bit about how successful this program has been. Would you describe it as being successful, and why?
I think it's been incredibly successful for a couple of reasons. One is we set this out to be a way for us to recruit staff. So for the first 9 years of the program, 95% of the graduates stayed and worked with us. Okay? So that was a way that we created a recruitment pool that wasn't there before. The second thing it did was create a retention opportunity, because we have a lot of staff who wanted to teach, and this was a way that they could teach in a local setting, not have to go only to an academic setting. So we think it's been great that way. We also think it's been great because the quality of care in communities that are small rural communities just goes up, because you have this great interest in high quality care with people learning cutting edge technology and medicine. So it's great that way.
How about any concern about the fact that these are very young doctors just starting out, and now these underserved populations are seeing these doctors with not a lot of experience?
Yeah.
Any concern there?
So there's always a concern about someone, but we don't have that concern, because in order to get into UNC Family Medicine residency, this is the #2 ranked residency program in the country. So they're only accepting the best of the best. So we think that we know we have that talent pool here, because it's a really highly successful program, and because of the teaching piece, they know advice is just a small phone call away. And that's true for any provider, but for them it's right there at their fingertips. So we think that's a really helpful thing.
And while I didn't think initially, at first hearing the story, there'd be people lining up to go to rural settings, I was surprised to learn that people are lining up at UNC. It's a very competitive program.
It's a hugely competitive program, and that's why we hope that this is a model that other places will take. We think this partnership with UNC and the Community Health Center is the ideal partnership to really grow these kinds of things, not just in North Carolina, but around the country. Again, North Carolina, 85% of the counties in 10 years will have more people over the age of 65 than under the age of 21 living in them. So that's an aging population staying in the rural parts of the state. How do we make sure we don't abandon people where they grew up and lived, and we can take care of them there? That's why we think this is an exciting way to bring the best of both worlds together.
And in a nutshell, when you talk to people out in the community or in other parts of the country, why would you describe this as a real win-win?
We don't struggle to get people interested in working in rural healthcare the way other places do. This makes it an exciting place to be, as opposed to, oh gosh, I hope I don't have to do that. It's the real difference between excitement and a chore.
Perfect, that's a great soundbite. I think that's it, unless can you think of anything else that you'd like to include, that you would like to have in this story?
You guys know what the story, you guys are the pros of what the story should look like.
I know, but you're the pro when it comes to the program and the benefits.
So what got you interested in it? Somebody told you to do it, and then you said, why did you want to do it? Why did you want to do this story?
Why?
Yeah.
Well, I think it's interesting, and I found it intriguing, because I thought, who wants to go and practice medicine? Most people, I would think, would want to go to a big hospital setting.
So I guess the one thing I do want to add is we don't want to take the heart out of physicians. Physicians go into medicine, primary care medicine, because they want to do great technical work, and they want to make sure they can have their heart in their work. this is an opportunity to bring both together that you don't see in large settings. It's a way to connect and feel like you've really made the difference in the lives of not just the patient in front of you, but their families and generations around them.
That's really good. I'd love to get that in more of a soundbite.
Good luck with.
That's really great, talking about the heart of medicine and sort of going back to how it used to be, you know?
So we think this program ensures that people can bring out their heart in medical care, in medicine. That's what most primary care providers want to do, is to put their heart and soul into it. Too often we make it too professional. This is a way to have professionals practicing heartfelt medicine.
Perfect. That's awesome. Thank you.
Great.
Thank you. That was wicked awesome.
Well, that's how I work. People come to my door and they interrupt me. What do you think? Actually, there is one other thing I do want to say, but I don't know if it's relevant to your thing.
Let's do this first and then we'll talk.
Okay.
Thank you.